I'm David Rees, the Assembly Member for Aberavon, but Chair of the Health and Social Care Committee in the National Assembly for Wales. And today we've been here in Wrexham to talk to groups of users and also to groups of people who support those individuals to look at the impact that legal highs or new psychoactive substances have on people and the communities, and how we can help those people get back into the community to challenge the whole concept of actually using or the need to use these new substances. This afternoon we've heard very much of the issues of preventative work. We have to ensure that education becomes a fore, and that's education to the teachers, to young people, to all ages, because these substances are not just being taken by young people, but also parents and anyone who actually works in the community or with public bodies. That's very important. But then also what clear pathways are available to any organisation, anyone who's looking to help those users to actually kick the habit and to get back on track. The next steps of the committee now are that we will take this information we have gathered today here in Wrexham, but also our colleagues down in the south, and put together some ideas for questions we will ask of people who will come to give us oral evidence in our next session, but also of the Minister, because we want to make sure that we're able to ask the questions which will help people and to help the organisations in the support mechanisms. But then we need to look at very carefully at what conclusions and recommendations we make so that we can put those into practice. There is still much work to be done, and we understand that this whole picture of the use of new psychoactive substances is not just Wales, it's a UK-wide basis, and we need to ensure that we work with the UK government as well to see how we can get joined up approaches to tackling this issue, both for services and for the criminal issues that arise as a consequence of these.